So what is depression really? Is it a lack of motivation, laziness, avoidance of responsibility? And are there different types of depression? Let's take a closer look. The first type that I would like to talk about is what we call major depression. This one is a big kahuna. It feels like a weight is on your back. So what are the symptoms? Persistent sadness throughout the day, disinterest in formerly enjoyed activities, a lack of desire for new activities, feeling unmotivated to do anything, even simple tasks such as showering, washing your clothes, going to the store, avoidance of crowds or people in general, thinking about the past or the future, feeling excessively guilty about things in your past or excessively worried about the future, inability to change what you're thinking about, like a record that's stuck, feeling angry or being easily agitated, difficulty with focus, difficulty making decisions, even small ones like, what do I wear today? A feeling of helplessness and hopelessness, thinking that life may never seem to get better, sudden urges to cry, a sensation that life is surreal, you're not actually living your life, you're observing your life, thoughts of self-harm or wanting to not be alive. So what are some of the physical symptoms of major depression? These could be unexplained aches and pains, reduced sex drive, sluggishness in movement or when talking, losing or gaining weight, digestive issues, difficulty getting to sleep or staying asleep, or wanting to sleep all the time. Perhaps wanting to sleep during the day and then up all night to avoid reality. Feeling tired and lethargic. So this level of depression is severe. There's actually a chemical change in the brain, meaning there's something in the brain that isn't functioning well. Our depression can be a response to an event in our lives, or it can come out of the blue. If it does come out of the blue, it may be related to events in your childhood. Major depression makes us largely unable to pull ourselves out of the muck. In order to start feeling better, energy is needed. Changes such as what we eat, increase in exercise, change in routines, and perhaps big changes such as our employment or getting out of a relationship may be necessary. So how do we get this energy? Sometimes the only way is to take medication, psychotropic medication, such as an antidepressant. This will elevate our mood enough to start feeling better and start making the changes that we need to in our lives. Now let's look at a different type of depression, persistent depressive disorder. This type of depression is different from major depression. It's a lower level of depression, but it has long-term symptoms. So what are the symptoms? Sadness, emptiness, or feeling down, loss of interest in daily activities, tiredness and lack of energy, low self-esteem, self-criticism, or feeling you're not capable, trouble focusing clearly and trouble making decisions, difficulty getting things done and done on time, quickly becoming annoyed, impatient, or angry, avoidance of social activities, feelings of guilt and worries over the past, fears about what might happen in the future, poor appetite or overeating, sleep problems, getting to sleep or staying asleep or sleeping excessively, hopelessness. This type of depression feels like a cloud is above your head all the time. That no matter what positive changes come your way in your life, there's always this little cloud. This type of depression usually starts early in life, in childhood, and there is often the experience of having a difficult childhood. Perhaps there was parental neglect or abuse, or the child was subject to domestic violence. This type of depression tends to respond well to lifestyle changes and/or antidepressant medication. So the next type of depression I'd like to take a closer look at is called Disruptive Mood Dysregulation. And this is occurring only in children. Diagnosed in children ages 6 to 18 who exhibit persistent irritability and frequent episodes of extreme acting out behavior, out of control behavior. Children living with this disorder show signs before the age of 10. Some of the symptoms are aggressive behavior, severe tantrums several times a week for at least 1 year, chronic irritability, difficulty functioning due to their irritability, reacting out of proportion to an event or situation. This type of depression responds well to counseling, both with the child individually, and then with the child and the parents, and then with the parents only. The next type of depression I'd like to take a look at is Premenstrual Dysphoric Disorder in women who are menstruating. Here are some of the symptoms. And these symptoms begin a few days prior to menstruation and usually resolve after menstruation. Affective stability, affective liability, shifts in mood, sudden sadness or crying, increased sensitivity to rejection. Irritability, anger or increased interpersonal conflicts. Depression, depressed mood, feelings of hopelessness, or self-depreciating thoughts. Anxiety, feelings of anxiousness, tension, or being keyed up or on edge. Lack of or a decrease in interest of usual activities, difficulty concentrating, fatigue or lack of energy, changes in appetite, overeating, or specific food cravings, hypersomnia or insomnia, sense of being overwhelmed or out of control. Other physical symptoms such as breast tenderness or swelling, joint or muscle pain, bloating, and weight gain. This type of depression is usually in very short periods of time. So we're looking at a few days to 5 days each month for a woman that's menstruating. This is a significant disorder in that some women are very, very much affected by mood changes during this time. This type of depression responds well to other people around them knowing what's happening and the person knowing what's happening so that they can be proactive in doing things that help them with their stress level, keeping the stress level low. So if you feel you have a form of depression, your first step is individual counseling to resolve some of your symptoms. And I just need to say that please do not diagnose family members and friends. They probably won't appreciate it. And if you like this video, please like and subscribe.